Good morning, everyone. And this is the last lecture for rehabilitation. And in this one, we are going to discuss about cardiac and cancer rehabilitation. So, to start with, I'm going to start with cardiac rehabilitation first. So, cardiac rehabilitation. Okay. So, what is cardiac rehabilitation, by the way? As you know, many people in this world, cardiac diseases is one of the cause by which many people die every year. The mortality is too high. So coronary heart diseases are very common. So it's not about just coronary heart disease, rather it's about all the cardiac conditions, like patients who have some sort of cardiac problems and who need like rehabilitation or who can be benefited from rehabilitation. And of course, the main aim of all this rehabilitation is to restore and maintain the optimal um, physiological, psychological, social, and emotional status of the patient. Of course, there is like a lot of goals which we have to achieve in cardiac rehabilitation. So of course, like the one and the first one and the important one is to improve and maintain a good level of cardiovascular fitness. Okay. Of course, like cardiovascular fitness is very important for our daily life to do normal function uh, in the society, to work, and for all the daily activities, whatever we do. So, of course, to make the people able to return back to work. Okay. Of course, um, different works are there. Like there are office jobs, there is labor jobs, and all this one. So, um, like cardiovascular, like the heart should be in good health to support all the blood supply. So, and for those like who are not able to go back to work, to maintain active life as possible, like as active life as it is possible, or to improve the quality of life. Okay, so and of course, one of the main aim of cardiac rehabilitation is patient education and reduction of cardiovascular um, risk factors, right? Okay, so as you know, like there are different educational program in most of the countries. They do a lot of what you can say awareness programs just to let the people know what are the things which can be bad for their health or which can be bad for their heart, and what are the things they can do to improve them. Of course, that thing is important. For example, quitting smoking, or uh, uh, taking care of their diabetes, or controlling their blood pressure, and what kind of diet they should eat to keep their cholesterol levels in normal limits, and also like many other drugs, by the way, which can basically help in um, um, boosting their cardiac health. As we know, like there are many reversible factors, and then there are many irreversible factors, which are the risk factor for coronary artery disease, like being a male, age, family history, or past history of cardiovascular problems are the irreversible one. Where are the reversible ones are hypertension, cigarette smoking, hyperlipidemia, diabetes, sedentary lifestyle, and type A personality. So of course, all these things should be Irreversible, we cannot do anything for that. But reversible, of course, we can manage them, or we can reduce them, or we can give some medications to avoid them, right? So now, um, of course, um, you have done this myocardial infarction, I think, in your first semester, like in when you started over in this campus, or when you started studying this clinical medication medicines. So we know cardiovascular diseases are very common, coronary heart diseases are very common, angina is common, myocardial infarction is common. Now, not just these, but many people, they do have congestive heart failure, they have cardiomyopathies, and many conditions are there. So, and nowadays, by the way, cardiac diseases are occurring even in younger people. Like before, it was considered like someone who is more than 65 years of age, just they get myocardial infarctions. But nowadays, we see many young people even with cardiovascular problems. Uh, like they get cardiovascular problems, they get myocardial infarction, they get angina, and things like this. Okay, so. Now, the good thing about what you can say about these things is what, when we do cardiac rehabilitation, the survival of the patients, it become better, it increases. Okay, it can let the people to uh, what you can say to be more functional, to be more like they develop more stamina in them and things like this. So now the important thing, like nowadays, of course, we have a lot of drug therapies, we have a lot of newer techniques, we have a lot of newer medications, we have a lot of newer processes, or you can say interventions by which we can treat cardiovascular conditions. And that's one of the thing, or that's one of the reason that nowadays the mortality due to cardiac diseases is decreasing. So I will not go in pathophysiology behind this thing, okay, but I will talk about what are the phases of cardiac rehabilitation. Okay, it gets divided into three phases: phase one, and then there is phase two, and then there is phase three. Okay, so in phase one, like whenever like any patient have any myocardial or any cardiac abnormality or any cardiac episode, like myocardial infarction, for example, of course they are hospitalized. So the first phase of the rehabilitation basically start from that point, like during acute um, inpatient hospitalization. Okay, so this is like the first stage, you can say, of rehabilitation. Cardiac rehabilitation start right away at that point. So after that, the second phase, that is basically outpatient basis, in which the patients are follow up in cardiac rehabilitation clinic, and it lasts for around 3 to 6 months. Okay, and then come the third phase, in which what happens is if we call it as maintenance phase. So in this one, there more attention is paid on their physical fitness, in risk factor reduction, and of course, like they provide patient education and things like this. So phase one, which starts right after like hospital admission, and then comes the phase two. So phase one is inpatient phase, okay, and it could last from 1 day to as long as like 14 days, okay. And then phase two, you can say it's a immediate outpatient period in which like the patient is discharged from the hospital, and then they keep on monitoring for 3 to 6 months the in outpatient, and they keep on checking uh, the risk and all those things. And phase three or four, this is like the maintenance period, as I told you, okay. And in this one, like they ask the patient to do regular exercises, to do some lifestyle changes and all those things. So as we know, exercise, like in pulmonary rehabilitation or cardiac rehabilitation, exercise plays a very important role. Like what like many of the, what you can say, general population, like I think nowadays the awareness is so much, like almost everyone knows what are the benefits of doing exercise. So like whenever we do exercise, by the way, there is increased oxygen consumption, there is increased blood supply, and what happens is like whenever we are doing exercise, um, like our cardiac output is increased, our heart rate is increased, our stroke volume is increased, and what happens, like due to that, the muscles, they get more strength, and there is increase in microcirculation. There is a lot of research, by the way, available. For example, they say that when you do exercise, it improves your memory even, because they have done researches, like they found proper brain changes in the patients, in the people who do regular exercise, as compared to the people who have sedentary lifestyle. Okay, so one of the thing, by the way, which we must know, is called as metabolic equivalent. Okay, and why I'm talking about this one, because uh, like it is written as MET, metabolic equivalent, right? So like there is a, like this is one of the way by which we can measure the effect of the exercise. So what is this metabolic equivalent? It is basically defined as a ratio of working uh, metabolic um, metabolic rate to basal. Basal means resting metabolic rate. Okay, what it means, like one met is equal to 3.5 milliliter of oxygen uh, consumed per kilogram of body weight per minute. Okay, so so this thing, like this thing is 1 met. Okay, or so now, like why I'm telling you this thing is because they measure this thing in met. So now, um, whenever we do cardiac rehabilitation in any patient, um, there is a lot of positive outcomes, like the patients who are like who follow cardiac rehabilitation, who get cardiac rehabilitation, basically it improves their exercise tolerance, as well as like they have many other benefits, like they get decreased symptoms. For example, like when the angina patients, they do graded exercises, they have decreases in the symptoms of angina, as well as they in the heart failure patient, they also get decrease, or you can say like the symptoms, the uh, like the amount of symptoms they were getting before, like get improves a lot. Okay, and these all things are, you can say, they have already checked by doing different type of imagings, like nuclear imagings and things like this. Also, um, uh, what you can say, whenever we do exercise, or whenever the patients, they are involved in cardiac rehabilitation, not just exercise but diet change, smoking cessation, and all those things, uh, it affects all the body, like their lipid levels, their lipoprotein levels, it also become better. Okay, their sleep become good, and also, like it is shown, it reduces stress, and it reduces the mortality in the patient, right? Okay, now, but there are some what you can say, um, uh, what you can say, there are some prerequisites, you can say, or who is the candidate for cardiac rehabilitation. Okay, so how they select, like, of course, like anyone, like all the patients who have myocardial infarction, anyone who have coronary artery bypass grafting, anyone who have ischemia, okay, anyone who have heart failure, anyone who have arrhythmias, okay. Other than that, anyone who have dilated cardio myopathies, okay. Okay, I will tell you, like, what are the contraindications as well, because when there is indications, because there are many contraindications for that as well. And like anyone, for example, who have valve replacements, okay. Also, anyone who have what you can say, aneurysms, resections done, okay, like, or simply you can say like any kind of procedure, heart procedures are done. But remember, there are some contraindications as well. For example, um, cardiac rehabilitation, there are some contraindications for the exercise training program. We don't go for, we don't allow anyone who have unstable angina, who have very high blood pressure, who have aortic stenosis, because there could be syncope, or they can go into cardiac arrest by this way. Anyone who have like ventricular arrhythmias, anyone who have third degree heart block and they are not on pacemaker, or anyone who have like recent embolism, or things like this, okay. So of course, like, these are all contraindications, like, we don't put them for cardiac rehabilitation programs, because like they can prove bad for them, or they can go into many complications. Okay, so uh, the now, what are the things, or what are the things which they can do? So you can say, we are going to talk about the things, for example, like the inpatient programs, or inpatient techniques, or uh, techniques which they use for the patients. Okay, so like one of the thing, like, for example, someone who is admitted in the hospital at phase one, what they do, like they go for activities which are uh, very low intensity. So now that concept will come. Basically, they let the patient to do exercises which basically have just 1-2 mets, okay, 1-2 mets. So like, for example, um, I will give you some examples that, when you move your arms, okay, like full range of motion, so that is 1.7 mets uh, rating exercise. But when you move your lower extremities, or like lower limbs, it is, you can say, 2 mets around, okay. And of course, like all those exercises which increase the heart rate, like isometric exercise, okay, yeah, they should not be done. Or for example, some all the exercises which increases the preload, like raising the legs, okay, they should not be done as well. So they go for the activities in the start, which are basically very low intensities type of exercises. So now, um, later on, once this acute period is gone, okay, in this 7 to 14 days, then they go for, uh, like you can say, in subacute period, they subacute period, they go like they um, go for uh, 3 to 4 mets, like all the things which basically are more, you can say, comparatively strenuous than this one. For example, uh, slow walking, okay, like slow walking takes around 2 to 3 minutes. Okay, like regularly, if you're walking very slowly, it is like it is going to take that. So of course, like, or if you are like just moving your upper limb or lower limb, so just move them, but move them slowly. Okay, so that thing. Or someone, for example, who is on wheelchair, and when they drive wheelchair themselves, again that consume like 2 to 3 minutes. So uh, that things are done. Okay, one of the things which we always use a thing called as graded exercise testing. Okay, or graded exercises. So okay, what are these? um, like graded exercise or graded exercise testing, how it is done. Basically what they do, they check how much the patient can tolerate. Okay, it have all like applications, like it is used for diagnosis, it is used for therapeutic, like uh, to increase the to give benefit to the patient, and as well as it is also used to check for the prognosis of the condition. Okay, so um, now basically what happens, like in the patients when they admit to the hospitals, what they do, like on the first day of you can say of the surgery, like when 24 hours is gone, they let the patient sit. Okay, or for example, if they ask the patient to walk, so they just ask them to walk like just for 1 minute, or sitting, or sometimes like they can go to bathroom if it is attached one. Day two, um, like you can say, day one you can just let them sit for one meal. Day two you can let them sit for all meals. Day two you can again let them to go to washroom, bathroom. Okay, or you can ask them to walk for 2 3 minutes. And day three you can ask them to walk for 4 to 5 minutes. Okay, and day four, like this, keep on increasing the intensity of the exercise. But now again, like different patients have different type of um, condition. Different patients, they have different type of um, you can say the severity of illness. So of course, like if the patient is severely ill, so you can say we will go more slow, but if the patient is better, so we can go a little fast in that case. So graded exercises, we increase like this. When what is graded exercise testing? Again, like if you have gone for any, what you can say, when you buy insurance, health insurance, they let you run on a treadmill, for example. So with time, they keep on increasing the speed, for example. So that is, you can say, they are increasing the grade of the exercise. Okay, so like this one. Now, how we use this graded exercise testing in diagnostics, if you know, like whenever someone have angina, so we do something called as exercise testing, or we can do something called as exercise um, echo echocardiography, right? So what they do, they ask the patient to do some exercise, and they do echo, and they see like what are the changes the patient is having. So with there is exercise uh, nuclear imaging as well. Okay, in that one, like they give some what you can say, a contrast to the patient, and then they ask the patient to do exercise, and they see like how is the perfusion of the heart, and if there is any area which is getting less perfusion, which means that that area is ischemic. If the patient cannot do exercise, then that can be done by giving some drugs as well, which increases the heart rate. That is called as pharmacologic stress testing. Okay, so again, like these are all the things I think which you have already gone through. So uh, like again, like by giving some drugs which increases the heart rate or myocardial activity, of course you are creating a condition which is similar to exercise. So all these things, they are available in cardiology clinics. These exercise machines, or these treadmills, or all these things, and they are used for diagnostic purposes. So now, again, there are some indications and contraindications to exercise testing as well. For example, someone who have too much changes coming on, or ischemic changes or coming on while commencing exercise, stop that. Unstable angina, remember, it is unstable angina is a contraindication for everything, you can say. Ventricular arrhythmia is one of them. Third degree heart block without pacemaker is one of them. Aortic stenosis, again the same thing. Symptomatic congestive heart failure, okay, all these things, of course, or thromboembolic conditions, they are all the contraindications for exercise testing as well. Okay. Okay, guys, here I will mention that, if like I'm sure like you guys know, but if you don't know, always, or if you forget that, always like go and revise that one thing, American Heart Association, or one thing is called as NYHA, New York Heart Association, fitness, or you can say heart grading. What they do is like class 1, class 2, class 3, class 4, things like this, right? So anyhow, like I'm not going to in more detail of like exercise testing, what are the indications, what are the contraindications. Of course, it's very very hard to remember all the indications as well as contraindications, but all the things, they are there. So now okay, so now I give you a few of the examples like about the meds, like how much slow walk takes, how much uh, brisk walk take. Like sexual intercourse, it takes like 3 to 4 meds, okay. And when we do like jogging, it takes like around 9 meds, okay. So all these things, they calculate. And by the way, that is one of the reason, for example, like if someone, like a patient is asking after myocardial infarction that, can they do go for sexual intercourse, or can they continue their sexual life. So again, evaluation is done on this basis, okay. Like either they are now ready for that type of you can say exercise or stress on the body or not, okay. So as we know, like there is a different type of physical activities, like um, there are aerobic exercises, okay. There is anaerobic or anaerobes activities as well, okay. There are what you can say stress training. There is isometric exercises and all the things. Of course, like that is all exercise physiology, but uh, uh, like not just this thing, but of course, like they always what you can say like until now what we are discussing is about exercises or about how much stress we can put on our body, but remember, it's not about just this thing, but cardiac rehabilitation involves everything, even diet, lifestyle, smoking, all the things are included in that one. So I was talking about NYHA heart, or you can say heart grading or heart functional classification, okay. So there are like different classes in that: class 1, class 2, class 3, and class 4. Class 1 is basically the patients. Um, class 1 is basically the patients who are uh, like who can do, you can say, different type of physical activities without any limitations, okay. So basically what this check is, like if someone can perform more than 7 minutes of activity without any sign and symptoms, without any complication, of course, it means, or someone who can carry uh, you can say 40 kilogram, or someone who can work with spade and things like that, or someone who can play basketball or handball, or someone who can do jogging. And then comes the class 2. So class 2 are those basically who have slight limitation on physical activity. For example, someone uh, who can do sexual intercourse, okay, what you can say, but what you can say, um, someone who can finish sexual intercourse without like interruption, of course, like that is class 1. But someone who like has some limitation, what you can say, and they started feeling like symptoms like palpitations or pain or all these things while doing the same activities which I told you before, they are graded as class 2. Then comes class 3, and class 3 are as like those people who have severe limitation to their physical activity, and like they always get all the symptoms whenever they are, for example, even doing some normal physical activity. And then comes the class 4, and class 4 are basically those who are unable to do any physical activity. So of course, like they cannot perform, like even like while walking they feel symptoms. So of course, like that's how the heart functionality is checked and graded. Okay. And based on that, of course, like the rehabilitation specialist, they decide what kind of type of exercise the patient can do, or what kind of exercise they must prescribe to the patient. Okay. So exercise, uh, you can say, prescription. Okay. So now what kind of exercises are there? Again, the same thing: aerobic, anaerobic, or isometric exercises, and all these things. So there is resistance exercises as well. So now, like we can ask the patient, like we can let the patient to walk or to jogging or to do cycling or to do swimming. Okay. Things like this. But remember, like whenever like we ask the patients to do exercise, or even the normal people, there should be a period of warming up of body, and then there should be exercise, and then there should be proper period to cool down. Okay. So then of course, like the rehabilitation specialists decide how much is the like what you can say, how much should be the um, you can say exercise intensity. So first of all, what type of exercise they decide for the patient depending on the patient condition. Then what intensity of the exercise they should do, like either they should okay. And how to calculate that is, by the way, target heart rate. If you know that, like you can minus your age from 220, and that is the maximum heart rate you can achieve while doing exercise. For example, if you're 20 years of age, so you're like while exercising, if your heart rate is going 180, that's completely fine. But if you are 60 years of age, so your heart rate should not go up till there. Okay. So this is one of the way. So of course, like remember, like the point of doing exercise is to increase your heart rate. Okay, if you're doing some exercise and your heart rate is not increasing, it means that exercise have no benefit, or no beneficial effect on the body. So this is one of the thing to remember. So and I told you one of the way to calculate that age predicted method of calculating the target heart rate. Okay. There are many other as well, but I think that's enough for this thing. And then they decide like how much should be the duration and frequency of exercise. Okay. For that particular patient, of course, like depending on patient to patient, it is variable. First of all, they have to look at the fitness of the patient. They have to see like how much maximum heart rate they can increase and what type of exercise they can do. Then they can tell the patient. Okay. So of course, like in graded, like this, they let the patient to start by from 3 to 5 minutes, and then after some time 10 minutes, then 15 minutes, and so on. So this is like one of the thing. And of course, like other than that, other than exercise, what are the other things which can be done, or which are the you can say other components uh, of this rehabilitation is the diet, patient education, okay, lifestyle, okay, um, cigarette quitting, like smoking, medications, of course, like to control their blood pressure, control their diabetes, okay, and all these things, and of course, like you can say psychosocial support, okay. Of course, like that is also a part of what you can say. See, okay. So psychosocial support should be given to the patient. So of course, like that is also a very important, you can say, thing which should be addressed in the patients. Okay. So now, um uh, of course, like different people, they do different type of jobs, uh, and like one of the thing which is the, you can say, the main aim of rehabilitation is to make the patient um, so much capable that he can go back to his work. So now, of course, like the okay, yes, and one of the thing is to, you can say, weight management as well. Okay, like the BMI thing. So of course, like if someone have BMI which is not in the normal well limits, so bring back to the normal limits. They can cut their calories, they can modify their diet, eat less fats, okay, and what you can say, take less cholesterol, and this thing, and of course, like the diet for the heart patient is different from what you can say. Uh, the normal people, of course, they must get enough calories, but they must change the portion of the thing which they're eating, and they must take, for example, more calories from proteins rather than fats. Okay, so things like this. So uh, this thing should be addressed, and patient education, tell them about the risk factors and benefits of exercise and things like this. And as I told you, lifestyle modification should be done, so that they should live more active style of living rather than sedentary lifestyle, which is again a risk factor for heart diseases, right? So this is about cardiac rehabilitation, and a very short introduction about cancer rehabilitation, because uh, uh, rehabilitation, okay, because like there are just few things to address, and I'm not going to go in very much detail about this thing. Okay, cancer rehabilitation have different type of what you can say approaches. For example, one of the thing is to, okay, one thing which I will mention at the start is the psycho social aspect, right? So of course, like we have to address this thing, the psychosocial aspect. Like we know, like when someone have cancer, so what is their state of mind, and how much psychological support they need. One of the thing is um, palliative rehabilitation therapy. As you know, what is palliation? That any patient who is at um, advanced stage of cancer, who cannot be treated, then of course palliative measurements are taken. For example, if they have pain, reduce that. If they have any obstruction, cure that. Like simply um, to let them go through this very painful period in comparatively, you can say, better way than, for example, like if you are not going to do any intervention, then they will be having what you can say a bad situation. So the goals is simple, that the cancers, they leave a very great impact on the physical and psychological status of the patient. And by rehabilitation, uh, like of course, if the cancer is for example cured, okay, now for example, if someone have a cancer in the bone and that is cured by amputation, then the amputation, like you must know what is the rehabilitation for amputation, right? uh, so of course, like they will give prostheses or orthotics, and like they will combine that, they will put the patient on that and all those things. Cancers are very common nowadays, but nowadays the good thing is like the life expectancy of the people is increasing because of better options like radiotherapy, chemotherapy, hormonal therapy, and early diagnostics and all these things, right? But of course, still, the cancers have a very devastating effect on the patients. Okay, and many of the people due to cancers, they become, you can say, bed bound. Okay, and again, like when it comes to bed bound, then like what are the uh, risks any bed bound patient may have. Again, that pressure sores, um, what you can say, embolism, contractures, muscle atrophy, and all those things, right? So of course, like those things are there. So Now the mm, aims or interventions, okay, uh, interventions for cancer rehabilitation are many. Okay, so what you can say, avoid any complications. Okay, complications with which can arise bed rest or immobility. Okay, like if the patient cannot move, so of course avoid any complications due to this thing. So now, um, okay, and if they are bedridden, or if they are immobile, um, giving um, range of motion exercises, okay, that will benefit contracture formations and uh, thromboembolism episodes like this, right? So strengthening exercises can be given. Okay, again, frequent repositioning, repositioning of course to avoid pressure sores. Okay, like nowadays air mattresses are there, by the way. Okay, so this thing, and then physiotherapy, again to avoid contractures and all these things. Okay, pain control, if the patient, cancer pains are very bad, by the way, very hard to manage, so pain control can be done. Okay, of course, like nutritional support. Okay, so like again, like whatever is coming in my mind, I am writing, that's it. Okay, so nutritional support, and of course like dealing with other complications, like whatever is there. Okay, depending on where is the cancer and what the patient have right now, what is the condition of the patient, because cancers can be in the brain, and brain cancers have different type of presentation. Or for example, a patient have cancer anywhere, it can metastasize to the brain, it can metastasize to the spinal cord, or all these things. And even like when the patient have cancers and they get treatment, chemotherapy, radiotherapy, they come with a lot of side effects, a bundle of side effects. Okay, so of course like uh, to deal with those side effects and all these things, of course, that is also a problem. Yes, and lymphedema, for example, uh, especially in breast cancer patients, when they remove the breast with the lymph nodes, of course, like the patients, they may have lymphedema, they have swelling of the limb. So again, like the rehabilitation people, what they do, they um, they basically give, what you can say, compression therapy. Okay, they give compression therapy, they reposition the limb to at a higher place so that the lymph should flow itself, or they give, what you can say, the lymph massage, or the massage to, you can say, facilitate the drainage of this thing. So that thing is important. Okay, so again, like cancer can be anywhere, and cancer can lead to anything like immobilization or xyz, anything. So of course, like one thing which is pain, which is very important, the pain control, I think like it's better that if you will study something called as WHO letter of pain, in which like we start with some normal painkillers like acetaminophen or NSAIDs, and then we go higher, like there is a combination with codeine, and later on we jump on uh, even higher type of medications like opioids. Okay, so WHO letter pain is very 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 important. Okay, so like it starts from a very normally available painkillers to going towards, what you can say, the opioids. Okay, and opioids, by the way, they are the last resort, and basically we can give it in as much as dose as we as like the patient, when the patient will feel relief, and like that's why they are the last option. So they are available nowadays in oral forms, in injectable forms, in patches like morphine, methadone, fentanyl. Many of the what you can say opioids are available. So WHO's ladder of pain is very very important. I think you can just see that. Okay, um, and very easy. Like it's very simple, by the way. Okay, so I think like it is not going to just help you in this topic. Rather, it will help you like all your lifetime, as you are seeing any patient with pain. And of course, like if any cancer patient in which like the pain cannot be controlled by this way, then they go for other options. Like sometimes they give the drugs intrathecally. Sometimes they divide the nerve. Okay. Okay. So of course, like these things are done. Then of course, like yes, one of the thing is vomiting. Okay, in cancer patients, vomiting are very important. And why vomiting come into my mind? Because remember, like when we give any patient opioids, one of the side effects of opioids is vomiting. So, and by the way, many of the patients, who are taking chemotherapy or radiotherapy, again, vomiting is one of the side effects. So one of the drug which is used to control vomiting in cancer patients is ondansetron. Okay, ondansetron. So ondansetron is a drug which is basically used to control vomiting. So that's all, guys, for cardiac and cancer rehabilitation. I hope you understand or like this lecture. So this is the last lecture for rehabilitation, rather like last lecture for all the semester. Thank you so much, and I will see you during the exams. Okay.